The third item in the NIH stroke scale tests the visual fields of both eyes. In the visual fields item, each eye is tested independently. Upper and lower quadrants are tested by confrontation. This means using finger movement, finger counting, or visual threat as appropriate. If a patient is unable to respond verbally, the examiner should check attention to responses to visual stimuli in all quadrants, or have the patient hold up the number of fingers seen. Make sure the patient is looking directly into your eyes during the testing. Tell the patient you will be testing peripheral vision and that you may move a finger to the right or a finger to the left or both. Then you test by asking the patient to count fingers in all 4 quadrants. Patients who scored a 3 on the level of consciousness, 1A, are tested using bilateral threat. Now the next thing I'm going to do is I want to test your vision. All right? So I'm going to help you cover your right eye.
Okay.
How many fingers do you see?
2.
Okay.
2.
How many fingers do you see?
5.
Good. And how many fingers do you see?
1.
And how many up there?
1 or 2.
Now look at me. How many fingers down there?
1. About 5. 1. 1.
For scale item number 3, this patient scored a 0. Let's look at how this scale item is scored. Score the item 0 if the upper and lower visual fields are normal. If the confused or language-impaired patient looks at the correct side of the moving finger, this is scored as normal. If a patient has severe monocular visual loss due to intrinsic eye disease and the visual fields in the other eye are normal, the examiner should score the visual fields as normal. Score a 1 only if you find a clear-cut asymmetry, including quadrantanopia or partial hemianopia. If there is an extinction, score the patient a 1.
And I want you to look at my nose and tell me, how many fingers do you see out of the corner of your eye?
2. 1.
Okay, look right at my nose. Look at me. How many up there?
2.
Okay. Look right at my nose. Look at me.
1.
Okay.
2. The whole hand.
Look at me. Look at me. Look at me.
3.
Look right at my nose.
2.
All right. Now switch hands and cover your left eye for me. All right. Again, look at my nose.
1. The whole hand. 1. 2. Look like 3 or 4.
Okay. How about now?
1.
Look at my nose.
Score a 2 for a complete hemianopia.
Cover your right eye for me. When you see a finger, you tell me how many fingers you see.
1.
Good.
1. 1. 1.
All right, now I want you to switch eyes, and we'll try the same thing again.
1. 5.
Good.
5.
Good.
Score a 3 for blindness of any cause, including cortical blindness, which requires a positive diagnosis, and double simultaneous stimulation testing.
All right. Do you see my hand moving?
Yes.
How about now?
Yes.
Okay. Do you see my hand moving now?
Yes, I do.
How about now?
Yes, I do.
All right. As soon as my hand moves, you say now.
Ow.
Okay, one last thing. I want you to look right here at me. Look right here at me. Very good. If there is unilateral blindness or enucleation, visual fields in the remaining eye are scored. The result of this item will have an impact on the last scale item, extinction and inattention, and many of us check double simultaneous stimulation to visual input at this point. There is an arbitrary rule that if they extinguish, the visual field item is scored a 1, even if the fields are intact to confrontation. This rule helps even out the variations that occur when inexperienced examiners encounter neglect so severe that the patient appears to have a visual field cut.